Hi, I'm Gregory Paul with Water Saver Solutions, and when it comes to managing water risk in healthcare, there's two standards we want to pay attention to, which I'm sure we're already familiar with, Standard 188 and 514. They're often mentioned together, but it's important to note that they're different, yet complementary. ASHRAE Standard 188 really focuses on introducing the water management plan, water risk management, understanding your pipes and potential risks, but it doesn't dive into specific details like 514 does. Namely, we want to start talking about the fixtures, or as we call them, critical control points. (188) really focuses on Legionella and viewing water from that particular lens. It doesn't go into other bacteria so much as 514 does. Ultimately, 188 asks us three questions. What are the risks in our water systems? What are the conditions that allow bacteria to grow? And how are we going to address, monitor, and maintain the safest environment for our patients? In simple terms, 188 tells us what needs to be managed and why. Naming our critical control points, understanding where they are in the hospital, monitoring our disinfectant levels to make sure chlorine levels are optimal, and ultimately making sure all the faucets and showers are as safe as possible for use. 188 laid the groundwork, but 514 dives into some deeper details on how maintenance should be performed. For example, making sure your flow is optimized, making sure you're refreshing your devices regularly, making sure the unit can be adapted to a point of use filter, making sure dead legs are managed and mitigated. It's not about checking boxes, it's about ultimately making patients safer in our healthcare environments. And that's why these standards best work together, not separately. One helps us understand the risk, and one recommends practical solutions. So from all of us at Water Saver Solutions, let's stay focused and keep our patients safe.